Here's something that should bother you. Your PIN code, the postal code of where you live, predicts your health better than your doctor's prescription does. Two babies born the same day, 10 kilometers apart, can have life expectancies a decade apart. Same biology, same hospitals down the road. So, what is actually deciding who stays healthy? Let me show you. This is the determinants of health. And by the end of next 4 minutes, you will be able to name every determinant, draw the model examiners love, and never lose a mark on it. Three things. What a determinant really is, the famous rainbow that maps them, and the exact keywords and MCQ trap your examiner will use. We love to believe health is made in the clinic, the right drug and the right doctor, but walk into community and the pattern is undeniable. The poorest fall sick more and die younger. And it isn't because they chose worse. Something upstream of the clinic is shaping health long before anyone reaches a hospital. Those upstream forces have a name: determinants. Start at the center with one person. At the very core sit the things you cannot change: your age, your gender, and your genetic constitutional makeup. Real but fixed. This is the biological determinant. And notice something crucial. It is the smallest ring. Around that core, the next layer, your lifestyle, what you eat, whether you smoke, drink, or move, these behavioral determinants matter enormously. But here's the catch: your choices are shaped by everything in the ring outside. People rarely choose badly in a vacuum. Wider still, your social and community networks, family, friends, support, social capital. Isolation harms health, connection protects it. Notice what just happened. We have left biology behind and stepped into society. And now the widest bands: your living and working conditions, housing, clean water and sanitation, and education, employment, food, and access to health services. And wrapped around all of it, the general socio-economic, cultural, and environmental conditions of your whole society. Now, this is your PIN code. This is why where you live predicts your health, because the outer bands are the biggest and they quietly decide the inner ones. Here's the exam definition and say it out loud with me. The determinants of health are the multiple factors: biological, behavioral, environmental, social economic, and health service that interact to determine the health of an individual and of populations. And the social ones, the conditions in which we are born, grow, live, work, and age, are the social determinants of health. That one sentence is your answer. Two children, same city, one has educated parents, piped water, a clean home, a school nearby, and a working clinic. The other has none of it. Give them identical genes, and the second child still gets sick more and lives shorter. Not because of biology, but because of the outer bands of the rainbow. So, why should you care? Three reasons. One, most of what keeps a population healthy sits outside the health sector, in housing, education, income, and clean water. Two, that is exactly why public health acts on the determinants and not just the diseases. Health in all policies. Three, the single biggest determinant is usually socioeconomic, which is precisely why your PIN code beats your prescription. For your written answer, the examiner is hunting for these keywords: determinants of health, biological, behavioral, environmental, socioeconomic, and health services. The social determinants of health, that is, the conditions in which people are born, grow, live, work, and age. That's the WHO line. The Dahlgren Whitehead rainbow model: upstream versus downstream factors, and health in all policies. Write those, get the marks. Can't hold all five? Use the mnemonic be she. Biological, behavioral, your lifestyle. Socioeconomic, health services, environmental. Be she decides your health. And remember, the outer letters, that is, the social ones, weigh the most. So just recap with me in 60 seconds. The determinants of health are biological, behavioral, environmental, socioeconomic, and health service factors. The social determinants are the conditions we are born, grow, live, work, and age in. And the Dahlgren Whitehead rainbow shows the outer social bands are the biggest, which is why your PIN code predicts your health. Now pause the video and answer this. Piped water supply, the mother's education, and per capita income are examples of which category of the determinants of health? A, B, C, or D? Rule out the wrong options first. Pause now. The answer is C. Socioeconomic and environmental determinants. Water, a mother's education and income are the social and economic conditions and not biology. Option A, biological, is what you're born with. Option B, behavioral, is personal lifestyle. And option D, health services, is the care system itself, not the living conditions around it. In the next episode, we will talk about why do people actually fall sick, that is the epidemiological triad. The notes of this video are in the description below. Subscribe to GM4T Academy and I'll see you there.